Hi, my name is Siggy Reyes and I'm with Bump Fit Physical Therapy, and I wanted to hop on here real quick just to kind of let you know about telehealth and how it all works. I know it's new for a lot of patients and a lot of patients are used to the hands-on approach, and I'm all for that. I'm a manual-based therapist, but with this COVID-19 and isolation, and we don't know how long exactly it's going to go on with restrictions. So I want to let people aware of how telehealth works and how it can help you starting today. I'm just going to go over the process a little bit of how it all works, because I know there's a lot of questions out there of, am I going to get the same kind of treatment as if I were to come into the clinic or if I was to go to your home? So the way that it works is, for the initial evaluation, I will send you all the paperwork, and after I get all that back, I send you a link. Now, we use a platform called Simple Practice. It's where I do all my documentation, and through there, they offer a HIPAA-compliant, encrypted, super safe and secure telehealth video conference calls to work with different patients. I want to go ahead and share my screen with you so that I can show you a little bit more of how this is going. All right, so we have here just a quick little one. I just made up this patient, Jane Doe. And so this is how it will appear. I can share the link with this person. I just sent it straight to myself. So I'm sending them a one reminder. So that's that. Go over to our email. Let's see if it'll come up here in a second. All right, so we got an appointment reminder here. It's loading, and this is kind of what it'll look like when you first start out. So you can add it to your calendar so that you remember. And all you're gonna have to do is you're gonna go through this join video call. So it's pretty simple of how all that works. And you can use it on your phone as well. We just advise that you download the app ahead of time. So, but it's, I haven't had anybody really have issues with it. So it's pretty straightforward, and from what my patients have said is they actually like it better than Zoom, because a lot of them are now working from home and they're using Zoom a lot, and they prefer the Simple Practice versus Zoom. So we're gonna pretend this is a new message for a new patient, just to kind of, go over everything. And we're going to, this is how it kind of looks for the exercises. So with every new patient, I will send, let me write this real quick because I can't multitask. I will send a customized home program, which is all video-based. So if you come on over to my next screen, this is my YouTube, and I have a bunch of different videos that I use for home programs. Now, if there's something, I don't know, random that I haven't thought of yet, and I use it specifically for a certain patient because it has something very specific that my other patients by chance just didn't have, I will make a new video specifically for that so that you do have the correct exercise. So you can see we have different exercises here of different stuff that was going on. So for example, if someone came in and we were doing something with like stretching the adductors, so we could say like butterfly stretch is something that we did, and you're gonna do it 2 times, and you're gonna hold for 1 minute each. And then we're going to do a, that's another good stretch. We're going to do a seated hamstring stretch. So seated hamstring stretch, same thing, 2 times, hold for 1 minute each. And then we're going to do a little bit of strengthening for this person as well. So we're going to do, let's do some waiter tips, pull aparts. They're going to do 2 sets of 10, and then they're going to do cat-cow for mobilization. So they have got a couple different things going on here, and they're going to do this for 2 minutes. So then what we would do, let's go back to there. We go over here and we would look for that certain exercise. So we talked a little bit about cat cow. So just go over here, we do our link, and we just link it straight into the email. So now they don't have to necessarily remember exactly what did the therapist say, how long am I supposed to do it for, and exactly how am I supposed to be doing this exercises. It's right there for her. For the patient, where we said also butterfly stretch. So come on over, highlight that one, link it in. So you get the idea. So basically, it'll be written out exactly kind of what we went over. Usually I'll add, like, this is kind of what we talked about. For example, if there's like any modifications that we talked about regarding how to set up their workstation or how to lift your baby, you know, something like that, that's specific to them, I'll just write a little blurb on there so that they have that reminder, and then we'll go over the stretches or exercises or mobility exercises that I want them to focus on until our next follow-up appointment. So that's a little bit of how it all works as far as telehealth. So we can do the evaluations, we can do follow-up treatment. To wait, there's no need to be in pain, especially if you recently had a baby or if you have been dealing with this for a while. If there's no need to wait, we can definitely help you out. So give us a call, give us a shout out, and I'd love to help you out. Thank you.